Okay, welcome everyone. Thanks for joining the breastfeeding class. As you know, my name is Karen, and I'm here to support you and to prepare for you for the feeding of breastfeeding journey. Breastfeeding is natural, but is also a learned skill for mom and baby. My goal today is to give you practical tools, confidence, and encouragement so that you are ready to begin this journey with your patient. Okay. The benefits of breastfeeding. Breastfeeding is a lifelong benefit for both mom and baby. The benefits for baby, they get stronger immune system, protects from infections, reduced risks of asthma, diabetes, and obesity for baby. For the mom, it's a faster recovery after birth, reduced risk of breast and ovarian cancers, and special bonding with their baby. Every drop of breast milk makes a difference, even if you only do it for a short period of time. So, exclusive breastfeeding means giving your baby only breast milk, no water, formula, juice, or solids for the first 6 months of life, unless there's a medical reason otherwise. Why it's important? It's complete nutrition. Breast milk has everything for the baby needed for healthy growth and development. Their immune protection, babies who are exclusive breastfed have fewer infections and illnesses. It protects milk supply, offers other breast milk, helps your body keep making plenty of milk. Healthy future. Exclusive breastfeeding lowers the risk of obesity, diabetes, and chronic disease later in life. After 6 months, they'll begin giving solid foods, but breast milk continues to be a major source of nutrition and comfort into the first year and beyond. Okay, so milk production. Many new moms worry they don't have enough milk, but the body is designed to provide exactly what the baby needs. In the first few days, the breast milk makes colostrum, a thick golden milk. It's very small in amount. This amount is enough for the baby's tiny tummy. Your mature milk usually comes in around 3 to 5 days after birth. At this time, the breast may feel fuller or heavier. Milk supply works by supply and demand. The more often that mom feeds the baby or they express breast milk, the more your body will make more milk. Almost all mothers are able to make enough milk. Frequent feeding, skin to skin contact, and responding to cues are key. So now let's switch over and watch this video. It is kind of small, so sorry about that.
You may have heard that your milk supply is based on the supply and demand process. While this is true, it doesn't start out that way. In the beginning, your milk supply is guided by hormones. Breast milk is produced in the mammary glands. The placenta releases the hormones estrogen and progesterone during pregnancy. The purpose of these hormones is to increase the size and number of milk ducts in your breasts. These milk-producing cells are called alveoli. During the last half of your pregnancy, your breasts are making colostrum. It stays in the breast because of the levels of progesterone, but it is there and ready when your baby arrives. The colostrum is full of wonderful nutrients and is just what your baby needs. Your baby doesn't need much at first as their tummy is small and the colostrum is very concentrated. Once you have your baby and the placenta is delivered, the hormones estrogen and progesterone decrease, and the hormones prolactin and oxytocin increase to cue your body to make more milk. People sometimes refer to this as your milk coming in. As this happens over the first few days, you may notice your breasts begin to feel firmer and fuller. You may also notice your baby swallowing more and see milk leaking from your breast. Prolactin controls the milk production, so every time you breastfeed your baby, you release prolactin, allowing your body to make more milk. Oxytocin controls the release or letdown of the milk through the ducts. It causes the milk to be squeezed out of the alveoli into the ducts and out of your nipple. This process is called the milk ejection reflex or letdown. While the hormones still play a role in maintaining your milk production, so does milk removal. This means the more milk that is removed from your breasts, the more milk that is made. Milk production slows down as the breast fills up and speeds up when the breast is empty. Babies feed a lot, and this helps your milk supply. Because they feed so often, it's easy to think they are not getting enough. The period of time between feedings or pumping sessions to satisfy your baby and keep milk supply up varies from person to person. Everyone has a different storage capacity, meaning the amount of milk the breast can hold between feedings, and it's not related to the size of the breast. A good example is with your daily water intake. You might think of it as working to get in 8 glasses of water a day. You could fill a 64-ounce container and drink from it all day, use a 32-ounce container and fill it twice, or use an 8-ounce glass and fill it frequently to get all your water for the day. So an empty breast actually makes more milk. This is where the supply and demand comes in. The breast will continue to make milk as long as milk is removed. When the breasts are full, the milk production slows down.
Okay, let's go back over for a minute. So feeding cues, babies show us when they're ready to eat. Early feeding cues include stirring or waking up, they're rooting or turning their head, bringing their hands to their mouth, and then making the sucking motion. So crying is actually a late sign of hunger. So try to respond to the baby before baby cries. Here's another video to kind of watch what this does. I don't think there's any words, but we'll see. Okay. So there are several positions you can use to breastfeed comfortably. The cradle hold, which is this one here. The cross cradle hold is where your arms over here, same position as baby. The football hold, which is this one here. Sideline down here. And the laid back position is the most comfortable position where you support mom and baby is baby-led feeding. We will probably learn more about this position more later. I'm learning a lot more about that right now, and maybe in our next competencies, we will go over that. So let's watch this video.
The way you hold your baby while you breastfeed is called a position or a hold. Because everyone is different, you may need to try several holds before you find the one that works best for you. Before we show you 5 popular positions, here are some basic facts. No matter which position you use, start by getting yourself in a comfortable position. Use pillows to cushion and support your body. Remember to always bring the baby to you instead of you going to the baby. Finally, make sure your baby's nose isn't covered by your breast. Babies breathe through their nose, and you don't want anything to block their breathing. Here are 5 positions that can help your baby latch onto your breast correctly and comfortably. The cross cradle hold works well when you're just learning to breastfeed, or if your baby is small, or if the baby has a hard time latching on. Here's how to do it. Place a pillow on your lap to support the baby. Lean back comfortably in your bed or chair. Place the baby on the pillow with their head facing your breast. Wrap your opposite arm around the baby's body, supporting the body with your forearm. Place your hand behind the baby's neck to support their head and shoulders. Still supporting the baby's neck and shoulders, bring the baby up to your breast. Use your other hand to hold your breast and help the baby latch on. The clutch or football hold is popular because babies seem to latch on well in this position. It's a good choice if you've had a cesarean birth because it doesn't put pressure on your incisions. It also works well if you have twins and you want to feed both babies at the same time. Here's how to do it. Place pillows behind your back and along your side. Lay the baby on the pillow perpendicular to your body. Support the baby's body in your forearm and their neck and head in your hand. Tuck the baby's legs between your arm and body like you were carrying a football. You can use your other hand to position your breast for the baby to latch on. The side lying position is another good option if you've had a cesarean birth because it doesn't press down on your incision. It also relieves pressure if your bottom is sore. Here's how to do it. Lay down on your side with your head on a pillow or on your arm. Use pillows to support your back. Set your baby on the bed or floor next to you. Support the baby's back and neck in your hand and pull them close to latch on. Placing a rolled baby blanket behind their back can help them stay on their side. You can use your other hand to hold your breast and help the baby latch on.
So I wanted to kind of interject right there. So if you see that mom is up on her arm, right there, tell your moms to stay in this position. Do not lay down on those pillows because then you're going to go to sleep, especially if it's at night and you're exhausted. Let them know to stay up on their hand. That way, if they do close their eyes and kind of go to sleep, if they fall forward, they're going to catch themselves. Or if they fall backwards, they're going to catch themselves. So that way, it's safety for baby.
Put your baby on the bed or floor next to you. Support the baby's back and neck in your hand and pull them close to latch on. Placing a rolled baby blanket behind their back can help them stay on their side. You can use your other hand to hold your breast and help the baby latch on. The cradle position is one of the most common breastfeeding positions. Here's how to do it. Make sure your own back is well supported. Place pillows under your arms and on your lap to raise the baby up to breast level. Cradle your baby in your arms on the same side as the breast you plan to use. Your baby's head should rest in the crook of your arm facing your breast. Support the baby's bottom with your hand. For newborns, their head, shoulders, and bottom should be in a line. Use your other hand to position your breast for the baby to latch on. This reclining position is comfortable for both you and your baby. It also lets the baby lead and follow their own natural instincts. Here's how to do it. Lay down with pillows supporting your back so you're not laying flat on your back. Place your baby with their stomach facing down on your belly. Let the baby enjoy the skin-to-skin contact and find your nipple at their own pace. If you need to, you can gently guide your baby to your breast. Once you've tried several positions, you'll learn which ones work best for you and your baby. The goal is for breastfeeding to be a comfortable and enjoyable experience for both of you. If you have any questions or need some help, remember to reach out to your healthcare provider, nurse, or lactation specialist anytime.
Okay. So latch. A deep, comfortable latch is the foundation to successful breastfeeding. Signs of a good latch include baby's mouth wide open, lips turned outward, the chin touching the breast, more areola visible above the top line than below the bottom lip. You feel gentle tugging, not pain. So this video will explain it better.
We're going to do a folded pillow on your side here. Folded pillow on your other side. We're going to put a little fort around your body to kind of keep baby up to the level of your breast. One of the things we want to do is unwrap baby and wake baby up first before feeding. If she's not interested in feeding, we can do a little skin to skin and just kind of play with her and talk to her, but she's ready. So the first step to a good latch is we're going to roll baby on the side. Have you take this hand, come around baby, thumb underneath the ear, index underneath the other ear. This hand, and you're going to shape the breast to match the shape of baby's mouth, almost coming underneath like the shape of a U. Okay. Nipple to nose. Wait for that wide open mouth. When she opens wide, she's telling you, I'm ready. I want you to put your hand down just a little bit more so that you don't block any of her latch. Perfect. When she starts sucking, I want you to take your hand and push in from the shoulder and roll the baby's head back just a little bit so that her nose is free. There we go. Sometimes it takes a few tries. There we go. So if it hurts at all, we want to make sure that you wedge the breast to match the shape of the mouth. Push in deeply from the shoulders. This allows the head to fall back. The nose falls away from the breast so they can breathe easily. And there's a nice little space right here that allows the baby to move her jaw efficiently. And if she's sleepy, you can use compression combined with stimulation to keep her actively feeding. Here we go. The perfect latch.
Okay. So next we'll talk about cluster feeding. Cluster feeding is when your baby nurses very frequently, sometimes every hour, often in the evening and during growth spurts. This is normal and doesn't mean you don't have enough milk. Cluster feeding helps increase your supply and is your baby's way of adjusting to growth. Respond to your baby's needs, and remember, this phase will pass. All right, so how often and how much? Newborns typically feed 8 to 12 times in a 24-hour period. So when we say every 2 to 3 hours, do the math, that's what that is. How do you know if your baby's getting enough? You can hear or see swallowing during feeds. Babies seem content after feeding. By day 4, baby should have at least 6 wet diapers and 3 to 4 yellow stools each day. Baby regains birth weight by 2 weeks and continues to gain steadily. Trust your baby to guide your frequency and length of feedings. Whoops, sorry. So then this is the Yomingo app. And it talks about baby feeding logs. So keeping track of feedings and diaper changes in the first week can be very helpful. A log helps you see patterns, reassures you that your baby is getting enough, and provides good information to the baby's doctor. So typically I would say take your feeding log to the doctor's office. They probably pretty much love that so they can see how things are going. And then here's a little video also. Talk about those.
Did you know that newborn babies need to be breastfed at least 8 times every 24 hours? But not on the day they are born. On their birthday, it's common for newborns to sleep for longer stretches. So you'll want to hold them skin to skin. Watch closely for feeding cues. and offer your breast often. After the first day or two, some newborns will want to eat around every 2 to 3 hours. Other babies may want to breastfeed many times in a short period, then sleep for longer stretches. Both of these patterns are normal. Using a feeding log. It's smart to begin tracking your baby's feedings and diapers right away. But with everything else going on around you, it can be easy to lose track of when your baby last ate, or how many wet or dirty diapers they've had. Because this information is very important, especially in the first days after your baby is born, the easy solution is to use a feeding log. What's a feeding log? It's a printed page with dates and blocks that make it fast and easy for you to track important baby activities and information, day by day, starting with the day your baby is born. Keep your feeding log and a pen or pencil close by, so you don't forget to fill it in every time you feed your baby or change diapers. How to use a feeding log. Let's take a closer look at how to fill out the information on your feeding log. At the top of the page is an explanation of what types of information you will be tracking. Time refers to the time of day when each feeding happened. For example, if you fed your new baby for the very first time at 2:30 in the afternoon on the day they were born, write 2:30 p.m. in the first box. Write the time of the next feeding in the next box, and so on across the first 24 hours after your baby's birth. Quality refers to how well each feeding went. G for good, F for fair, and P for poor. At the bottom of the feeding log page is an explanation of these terms as they relate to breastfeeding. In this example, the quality of the very first feeding was F for fair. Marking the quality of the feeding helps you and your healthcare provider or lactation consultant understand how well your baby is breastfeeding. Length is how long the baby fed from each breast, written in minutes. In this example, the baby fed for 10 minutes from one breast and 10 minutes from the other breast. All feedings are important, and this is just a guide to help you remember. Underneath these 3 lines, circle how many wet and how many dirty diapers your baby had during the first 24 hours after birth. In this example, this baby met the goal of 1 wet and 1 black soiled diaper. Your baby may have more wet or dirty diapers per day than the goal, and that is normal. After the first 24 hours, start tracking feedings and diapers in the Day 2 section. That's all there is to it. Of course, like anything worth doing, using a feeding log will take a little practice, but you will quickly get the hang of it. Paying attention to the daily goals and tracking every feeding and diaper change is an easy way to follow your baby's growth and progress. It can also let you know if you should reach out to your healthcare provider or lactation consultant for some help. You can do this, and it's definitely worth doing.
Okay, so the size of the baby's stomach is very small. A newborn's stomach, again, very small, which is why they need to eat very frequently. Day 1, it's a marble size. It holds 5 to 7 mLs. Day 3, it's a walnut size, or here a cherry tomato, 22 to 37 mLs. 1 week, about an apricot size, 45 to 60. About a month old is about the size of an egg, which takes 80 to 150 mLs. This explains why small amount of colostrum are perfect in the beginning. Hand expression. So when baby is like first day old, and moms are worried about pumping and all of those things, hand expression should be your first tool to go to. Hand expression, 1, lets mom see that the milk is there. Sometimes it'll stick around the flange and it doesn't go into the little container or the bottle. So it's best for them to get a syringe and or a little medicine cup and hand express. That way they can pull it right out of the nipple. Because we got a lot of moms going home that are pumping and not putting babies to breast because they're worried about what needs to happen. So, hand expression is a valuable skill every mother should know. It can help collect colostrum right after birth, soften the breast before latching, or even relieve fullness. With the doctor's approval, moms can also begin gentle hand expression at 37 weeks of pregnancy. This also helps you become familiar with the technique and sometimes collect a small amount of colostrum before delivery. And then you would bring that with you when they come to the hospital. Stop if you begin to contract. Contractions may be a sign your body is not ready, and it's important to keep you and your baby safe. Let's watch this video.
If baby's having a hard time feeding, you can hand express for up to about 5 minutes and actually get something to collect and feed your baby. Okay. Tonight's going to be a long night, so if you need to calm baby because baby's so fussy, baby won't latch, do a little bit of hand expression first. Okay. You can use a dropper, or we can use a little bit of cup feeding and feed your baby some of your expressed milk. Once baby calms, you can put baby back to the breast. Okay? In the very beginning, milk is very thick. It's like melted butter in consistency. So the pump will take some or very little out. Hand expression is the best way to express milk to feed. Okay, so I'm going to teach you the technique first. Okay. You always want a container to collect it in, a medicine cup or a small bottle. And what you're going to do is you're going to expose one side. You can start with doing a little bit of a circular massage or anything like that to kind of get the milk flowing. Do that for a few minutes. If it's after a feeding or after a pumping, you don't need to do that for too long. Okay. The technique is what you're going to do is you're going to go behind the areola or about an inch from the nipple with a thumb. I want you to put your thumb here. I can't
see if we can get.
If baby's having a hard time feeding, you can hand express for up to about 5 minutes and actually get something to collect and feed your baby. Okay. Tonight's going to be a long night, so if you need to calm baby because baby's so fussy, baby won't latch, do a little bit of hand expression first. Okay. You can use a dropper, or we can use a little bit of cup feeding and feed your baby some of your expressed milk. Once baby calms, you can put baby back to the breast. Okay? In the very beginning, milk is very thick. It's like melted butter in consistency. So the pump will take some or very little out. Hand expression is the best way to express milk to feed. Okay, so I'm going to teach you the technique first. Okay. You always want a container to collect it in, a medicine cup or a small bottle. And what you're going to do is you're going to expose one side. You can start with doing a little bit of a circular massage or anything like that to kind of get the milk flowing. Do that for a few minutes. If it's after a feeding or after a pumping, you don't need to do that for too long. Okay. The technique is what you're going to do is you're going to go behind the areola or about an inch from the nipple with a thumb. I want you to put your thumb here. I can't split my hand that way. Put your thumb on the bottom. Your index finger on the bottom. You're going to kind of make a C. Okay. The technique is you're going to go straight back, and then you're going to compress your index finger and thumb together until you get milk. With your other hand, you're going to kind of put that right there and collect the milk. So you're going to do straight back, compress together, and hold until you collect some milk. And you can see it continues to flow. Hold that pressure until it slows down. Relax, straight back, compress until you get that flow of milk, and relax again. So you'll continue to do that for a few minutes until you get your desired amount to feed the baby. Okay. We want you to avoid rolling your finger to the tip of the nipple. There's no milk in the nipple, and it pinches. Yeah, I could feel the difference. And look at that milk. Most people don't realize they even have that milk in there because it's so hard to get out.
Okay. So when they do collect, you have a sterile container or syringe, label it with the date and time, and then they can freeze it and then bring it to the hospital with you. So if you're in the hospital, you will put the date and time on a baby sticker and put it in the fridge, or they can be good on the counter for 4 hours after they collect. And here's the chart. So on the counter, ideally it's 4 hours, 4 days in the fridge, 3 months. In the regular freezer, a deep freezer is 6 to 12 months. Now, if you unthaw it, it's only good for 1 to 2 hours. So if they bring it into the hospital and it was frozen, and for some reason they forgot and it unthawed, it's only good for 1 to 2 hours. You can put it in the fridge for up to 24 hours. Okay. Never refreeze it. So, but if it's come in and it was frozen, it's still frozen, you can put it back in the freezer. Okay. So any leftover that has put into a bottle and baby has touched it. So if you put it in the bottle, baby's got it in the mouth somehow by nipple, well, I mean by syringe, or the the nipple in the bottle. Sorry, I can't think of it. But anyway, it has to be used within 2 hours. You can't put it back in the fridge. You can't do anything. We have to throw it away. So there's that. All right. Let's see. Give birth and becoming a parent changes everything for them, their routine, their outlook, your family, your relationships. If you trust your instincts, pack your patience, pay attention to your baby, and reach out for help when they need it or when you need it, you will do very well. So I want to thank you for attending the class. I do want to go over a little bit about the Yomingo app. One more time, I will show it. So you guys can download it, whatever you need to do. This is when I would ask questions. You guys could ask questions at the time in class. And here is the app that you would probably need to scan and download on your phone. And it has a counter timer, a kick counter, a feeding log, diaper log, measurements, appointments, all these things. Very good for mom. Also, we are going to be adding some more educational on there for mom. So more to come on this. So I want to thank you guys very much and your patience. Hopefully this comes through clear and everybody can see everything. And I will see you in class. Thank you.